First and foremost, I would definitely say the patients benefit the most because they're able to stay in their own environment, they're able to stay where they feel comfortable. And second, I would say the facility themselves, the facilities benefit financially for a number of reasons. One, they get to eliminate transportation costs because their patients get to stay at their facility and they're not losing them to the hospital. Secondly, would be the clinical costs of the actual study are significantly cheaper than what the hospitals charge modifieds. And then third would be the productivity issue in the rehab departments. Because the speech therapist gets to be a part of the test, their productivity remains up and they're able to bill their appropriate dysphagia therapy to go along with that patient for that day. Not only do they have great bedside manner, they have great personalities, they're fun, exciting, loving, they also have great clinical skills. They set themselves apart by having a minimum of 200 scopes passed in an acute care setting. They also have esophageal dysphagia training as well as certified in CPR, and they have a lot of experience interpretation. They're absolutely wonderful. Portable, and you can have it right at the bedside, but also the clinical information is better. You're not exposing the patient to so much radiation. You're not feeding them barium, which is constipating. You're also using real food. And because you're using fees, in theory, you could scope a patient for an entire meal. You can't just limit them to 4 to 5 minutes due to the radiation exposure. You can get more in-depth testing and better clinical knowledge with true clinical excellence.